Welcome to Askbys podcast, a monthly podcast brought to you by Bainbridge Youth Services and its supporting sponsors. Askbys podcast connects parents to professionals that can provide support, education, and resources on a particular topic in parenting. My name is Shannon Ameling, and I am your host. I am here with Milagro Castilleja as our producer. We're recording live at the Media Arts Studio at BARN, the Bainbridge Artisan Resource Network. Today's episode is sponsored by Quick Lock and Windermere Realty of Bainbridge Island. We are happy to welcome our parent guest, Mairead Shutt, a Bainbridge Island resident and mother of three.
Hi there, happy to be here.
And our professional guest, Elizabeth Zaroff, ARNP, a nurse practitioner from Peninsula Community Health Services.
Thanks so much for having me.
Thank you both for being here. Today's episode is Mental Health in the Body, a conversation with a nurse practitioner about how mental health and physical health are intertwined. Go ahead.
Hi, Elizabeth. It's so nice to talk with you today.
Yeah, it's so great to talk with you, Mairead.
I just wanted to get us started from a big picture. If you would just give us an orientation into how mental health and the body are connected and related.
Yeah, I think that's a great place to start. So even just by saying mental health and physical health, we imply that there's this distinction when really they are profoundly connected. Certainly our society and our insurance coverage often wants them to be treated individually, but it's really hard to parse those out into two separate things. And we can see them intertwined and connected in a variety of ways. So I'll kind of go through some examples for how we see that connection play out. So certainly with mental health conditions such as depression or anxiety, we see a lot of physical symptoms associated with those as well. And that can sometimes lead to different physical health effects down the line. Thinking about depression, that affects energy levels, so we might see a decrease in physical activity, changes in eating habits, which could put someone at further risk for diabetes or high blood pressure problems in the long run. But we also see physical health have an impact on mental health as well. Taking chronic pain, for example, that's something that has a profound impact on our ability to function, our ability to maintain physical activity, stay connected with the folks in our lives, take part in activities that bring you joy, and that can certainly lead to a worsening of mental health as well. And then we see some connections where we see mental health and physical health co-occurring. So a few examples that come to mind for that with thyroid problems, so the thyroid hormone being either too low or too high, can have a significant impact on mental health. With low thyroid hormone, we see conditions like depression. With high thyroid hormone, we can see anxiety as a symptom of that. And as well as a condition like irritable bowel syndrome, IBS, we often see depression or anxiety co-occurring with that type of condition. And there are some physical underpinnings that might be why we see those together as well. So serotonin, a neurotransmitter that's important for depression, is produced in the gut. And so sometimes we see gut dysfunction. And a treatment for IBS is taking an antidepressant, even without that mental health component, because that serotonin can impact the gut. So we really see a lot of different ways in which these conditions are linked. And as a healthcare provider, sometimes we try and parse those out into separate conditions, but we are always looking at the whole picture holistically of how those intertwine as well.
Got it. We can't parse them out maybe as neatly as we would always like to.
No, I don't think we can, as much as we might try.
Do you see certain mental health challenges impacting certain body systems more than others?
We do. So the mental health conditions have an impact on a variety of different body systems, but some we do see more than others. So some of the top ones that we see would be impacts on energy, appetite, and sleep. So with energy, for example, with depression, we often see fatigue, low energy, lethargy, versus with anxiety, someone's energy may be kind of keyed up, more alert, on edge with that energy. And then with appetite, with depression, we can see changes with high or low appetite. So someone may be having a high appetite, overeating, eating in excess, or may have very low appetite, even to the point of weight loss. And similarly with anxiety, we often see gastric impacts. So gastric distress, nausea, vomiting, stomach aches, which can have an impact on appetite as well. And with sleep having a lot of impacts from different mental health conditions, as with appetite, depression can impact sleep, kind of having more or less sleep. So we often see insomnia, but we might see hypersomnolence or increased sleep, difficulty getting going in the morning with that condition. With anxiety or PTSD, we often see insomnia as well. But there are some body systems that are less affected, that are less kind of, less obvious in terms of how they're affected. So we see cardiovascular impacts from mental health conditions. With anxiety, people might be experiencing a rapid heartbeat. We actually see an increase in risk factors for cardiovascular heart disease with depression. We also see decreased immune response with certain mental health conditions, worsening chronic pain, and even increased inflammation in the body. So those are some body systems that might not come to mind when you think of mental health, but we really see mental health conditions impacting quite a variety of those body systems.
Got it. Thank you. What is one thing you wish all teens knew about their body and their mental health?
So what I wish teens knew, and that their parents knew as well, is how important sleep is for your mental health. I think that sleep is so easy to forgo in its importance in our society, and teens have a lot of different pressures on them. They may be up late doing schoolwork, out late, at sports events, or just socializing. But sleep really has a profound impact on mental health. I work in a school-based health center, so I talk with teens very frequently about their sleep, and it's not uncommon for me to hear that they're getting 6 hours of sleep at night when really we'd be aiming more for 9 to 10 in those adolescent years. And this can have a really important impact on their mental health. And it's something then that we want to prioritize in terms of both to prevent mental health conditions as well as treating mental health conditions, is focusing on sleep.
Are there things teens can do to help themselves as their natural body clock is shifting? They're less sleepy at 9 or 10 o'clock when their parents are going to bed?
Yeah,
That's
it's
kind
so
of the
tough.
reality in my house.
Yeah, certainly, our school start times aren't always accommodating for the kind of shift in circadian rhythm that we see happening in the teen years. But there are some things that we can do for teens and in the family to help to support them to develop good sleep habits and prioritize sleep. So one of those is having what we call good sleep hygiene, and that's something that can be really incorporated in the family as well, because as adults we certainly can benefit from better sleep too. So that often can look like having a kind of a family rule or limits on screen time before bed. So ideally having screens put away an hour before bedtime to help our body kind of get into that natural state, help increase that melatonin production at night. I hear a lot from teens, it's so hard to not be on social media late at night, but trying to decrease that, especially at that time of day, trying to keep phones outside of the room, maybe getting an old-fashioned radio alarm clock instead of the phone to keep the phone out of the room. Can be helpful. Avoiding exercise late at night, that tends to kind of increase those hormones that make it harder to fall asleep. And then in the morning, trying to get exposure to natural sunlight to help kind of set the day up for success with our circadian rhythm and melatonin production can be helpful as well.
Got it. That's excellent.
Yeah.
Can you talk about how physical health and being physically active impacts mental health? You've kind of touched on that, but I guess I'm thinking more about what are the benefits to being physically active?
Yeah, so there are a lot of benefits to being physically active. And again, I think our society often focuses on physical activity for weight loss benefits, and that's really not what we want to be focusing on for exercise and physical activity, because there are many benefits that are totally unrelated to that, and we live in a society that's really quite focused on that often. But physical activity and exercise can both help to prevent anxiety and depression as well as lessen the symptoms of that for some people. I do want to caveat that while that can be an important part of promoting good mental health and for treating mild depression and anxiety symptoms, it certainly shouldn't be the only treatment for a more severe mental health condition. But we do see that regular exercise is associated with improved sleep, reduced stress, and a lower risk of depression. And so one of the ways that I try and talk with teens and as well as adults about how to incorporate physical activity into their lives is to find some way to move your body that brings you joy. So we don't want to be thinking of exercise as a chore that we have to do, and it doesn't even really have to be thought of as exercise. There are many ways to move your body. Walking is a great one. That is really wonderful for your body and for your mental health, and one that we don't always think of as being physically active. That's definitely something I turn to a lot for my mental health, getting outside, getting my body moving, but also, dancing, swimming, hiking, Zumba, rollerblading, sports. These are all different ways that we can be moving our body. And so finding one that will help bring you joy, help kind of lift your heart rate, lift your spirits, is a great thing to be incorporating into your regular routine and daily life.
Got it. One thing I'm thinking about is how we motivate young people who are not already involved in organized activities, sports after school. And I think it's wonderful to be like, find something you love. I also think for young people and teenagers, there's kind of this reluctance, and they're used to things being so kind of organized. And I just wondered if you had any thoughts about how we as a community can help kids be active, even if they're not on the track to be in competitive sports.
Yeah, absolutely. As someone who did not participate in competitive sports, I definitely can relate to that. And so, I think we're really fortunate living in Bainbridge and Kitsap County with the wonderful outdoor space that is available to us through our parks and through the trail systems. So that is definitely a good way to have more outlets for getting outside or getting moving. But there are a lot of different ways to participate in activities that are not just, organized sports through your school or competitively through the Parks District. There are a lot of different programs offered through the Parks District, both on Bainbridge and in Paulsbo and North Kitsap, being the areas I'm most familiar with. And so those can be outlets for promoting physical activity. But in terms of how we can help to make that kind of more easy or accessible for someone who is not already involved, I do think that starting as a family and making that a part of your family culture can be helpful. So if that involves, getting outside, and if you have a yard, doing yard activities on the weekends or going for hikes or walks as a family, or other outings, we often see that can be helpful for making that a bit more of a group activity, or working with your friends to, if there's a common interest there of going to the park and going roller skating or trying out those new activities, can be helpful to not be on your own in doing that.
That's great.
Yeah.
Thanks.
Yeah.
Can you please talk about when there are challenges like depression and anxiety for teens, and it's difficult for them to make healthy choices in terms of eating, physical activity, and sleep, what parents can and should be doing?
Yeah, I think that's a great question. As I mentioned, with some of the symptoms that we see with depression affecting energy levels can really make it hard to get going and engage in those healthy choices. And so thinking about how we as families can help to support them is really important for promoting those beneficial behaviors. So the first I want to kind of recognize is helping to kind of meet your child where they're at with support and empathy and acceptance. Sometimes I'll hear from teens that their family thinks that they're being lazy and unmotivated in terms of, not getting their schoolwork done or not making these healthy choices. And that can be a really tough place to be at. And isn't the best for helping to promote those activities if we're putting it on the teen as their fault, or due to a lack of motivation when there's a health condition like depression contributing to that change in motivation and energy level. So some of the things that we can do are helping to make those choices as easily accessible as possible. So in terms of thinking about healthy eating, having access to healthy and nutritious foods that are easy to grab, as opposed to more processed or not as nutritious foods. Having that be an easy choice to do, as opposed to it's easier to grab a bag of chips than to have to clean off the vegetables, cut them up. We're going to see both for teens and adults that the easy choice is going to be the one that we're more likely to make. So having those options that you're wanting to promote be accessible for your teen can be helpful in making those choices. Also, having meals together as family can help to promote making those good choices in terms of nutritious foods. And that is something that we definitely can see impacting mental health, is the foods that our teens are eating. Not getting enough protein can certainly contribute to low energy levels. Not drinking enough water. So many people are not drinking enough water, and I hear that from teens a lot, that they're dehydrated, and that can have an impact on their mental and physical health as well. And helping to decrease high caffeine use. Sometimes I hear from my teens that I work with about having a lot of energy drinks and coffee. That can really impact sleep. So helping to promote those healthy choices as a family. In terms of sleep, we kind of talked a little bit about those sleep habits and sleep hygiene. And so incorporating that as something for the whole family can be helpful in promoting that for your teen. And I guess we also talked a little bit about that activity, making that part of the family culture can be supportive for our teens as well.
Excellent. That is so helpful. Are there what questions haven't I asked that are on your mind?
Yeah, so one of the things that I definitely want teens to know in regards to their mental health is that there is help available. This isn't something they have to be dealing with on their own. Certainly, Bainbridge Youth Services is a wonderful resource in our community for accessing mental health support and counseling. But as we all are aware, we don't have enough mental health treatment available in most of our areas of the country, and so there can be long wait lists sometimes for getting access to that. So there are other avenues that I would encourage folks to take in terms of talking to primary care providers like myself. We can often help to connect to resources. If medication is going to be a part of the mental health treatment plan, primary care providers can do a lot with that, whereas it takes a really long time to get in with a psychiatric specialist. And so that's something that I want teens and their families to be aware of, is those resources in our community, and that it's not their fault. These are really common conditions. We see anxiety and depression quite a lot in our general population and in our teens as well. So, they're not on their own and don't have to struggle with that by themselves. But I did also want to, in kind of talking about the role of primary care, talk a little bit about what you might expect in terms of mental health services in a primary care setting. So this is something that your primary care provider, whether that's a doctor, nurse practitioner, physician assistant, should be screening for when you go in for your annual checkup. And that might look like getting a questionnaire, which we want the teen to fill out on their own, not having the parent fill that out for them. And you should also expect that at some point in the visit that the parent or guardian may be asked to leave the room so that the teen can talk with the clinician on their own. And this is not to exclude parents from being a part of the conversation, but we do sometimes see that it's easier to bring up those concerns with someone that is not in your family and might be more comfortable broaching the subject with them. And we will absolutely bring the parent in to help facilitate conversations around how we can support the teen. But I just want parents to not be surprised if they're asked to leave for part of the visit. We're really just wanting to help to make sure that your teen is in the best place possible, and that they're safe and healthy, and how we can help to promote not just their physical health but their mental health as well. And having adults in your child's life can be a really protective factor for their mental health. So we see that having a trusted adult, whether that's a parent, an aunt or uncle, a family friend, a school professional, a medical professional, can be really protective for improving resiliency for teen mental health too. And kind of one other thing that came to mind when you brought up this conversation is I recently had listened to some great podcast episodes on the Ezra Klein show. They did a 2-part series on teen mental health in the U.S., and that could be good further listening for someone if they're wanting to kind of continue this conversation.
Oh, great. I'll check that out. Thank you, Elizabeth.
It's my pleasure.
Thank you both, Mairead and Elizabeth, for allowing us to be part of your conversation today. Thank you all who have joined us. We hope that this conversation proves to be of benefit to you in your parenting. We leave you with the foundation that healthy youth begin with healthy families, and healthy families build healthy communities. BYS is a nonprofit organization that is supported by community members like you. For more information, please visit ASKbys.org. We thank Milagro Castilleja for producing our show. Another big thanks to MARN, the Bainbridge Artisan Resource Network, for their generosity in allowing us to record in their media arts studio.